We said thank you to the NHS this weekend on its 72nd birthday. Well, on the show, we launched our You Care, We Care campaign. It's all about supporting the mental health of those on the front line, and so far it's helped over 20,000 NHS workers. And we can join Dr Amir live at Airedale Hospital in West Yorkshire in just a moment. First though, here's some of their staff at the hospital explaining why wellbeing, mental health is so very important.
There's a famous saying that health is wealth, and medically speaking, health is just not mere absence of disease, but it is a combination of mental, physical and social well-being.
A lot of people have suffered with anxiety that haven't necessarily before. I know I have. You know, you can't necessarily show it when you're at work because you're there to support the patients. The patients aren't there to support you, you know. It does get really difficult at times, and it's not a job that you can just leave at the door. You do come home with it.
My mental health is important to me because I strive to create a happy environment for the children I look after.
My wellness is important because if I'm well, I can continue to be a compassionate leader, offering support and guidance to all members of my team.
Patients who are living with cancer or receiving treatment at Airedale Hospital should know that they matter, and if I am well, then I can provide the best possible care and support to both patients and their families with a big smile.
Well, Dr Amir is live at Airedale Hospital in West Yorkshire, and I guess the mental health and well-being of all of you, all the NHS staff, matters more than ever because there is a real danger of burnout, isn't there?
Absolutely, Lorraine. Morning, everyone. Yeah, it's difficult. So the NHS has been through an unprecedented challenge over the last 3 months, but the staff have risen up to that challenge significantly and magnificently. But it's easy to forget, you know, with the lockdown easing, that these challenges are still continuing. Patients are still getting sick. Patients are still getting sick with the coronavirus and coming into hospital. And that is an ongoing challenge for NHS staff. Now, patients, we're used to talking to patients about how poorly they are. We're used to talking to families about bereavement. But what we're not used to is the unrelenting frequency of which we've had to do it over the last 3 months. And all of that takes a toll on our mental health. We're really good at looking after patients' physical and mental well-being, but perhaps not so good at looking after ourselves and our well-being. And that is really important after the last 3 months in particular.
No, you're absolutely right. I
now,
mean, it's...
I'm here
yeah. No, you continue, please.
Sorry. OK, so it's been the NHS's 72nd birthday this weekend, but actually I'm here in West Yorkshire at Airedale, where it's celebrating its 50th birthday. Now, they had lots of things planned for that, but unfortunately, because of the pandemic, that wasn't allowed to go ahead. But one thing they did press on with is creating this garden, which is significant because it's here to manage the well-being of the staff. And it was funded partly by the NHS Charities Together, funded partly by local charities as well and local people. So I'm joined by two of its staff members. Here we have Angela. Now, Angela's been working here for 19 years, started off as a nurse and is now a matron. And unfortunately, Angela got the virus in April. And while she was unwell, her dad also got sick with the virus and very, very sadly passed away. Angela, just tell us a little bit about what that felt like.
I was really unwell. I'd had time off work with the coronavirus, having to self-isolate and actually be really sick in bed. But by my second week of recovery, where I was desperate to get back to support my colleagues on the front line, my dad unfortunately took ill with the virus and got admitted to my hospital being cared for by my colleagues. When I returned to work at the end of the week, he unfortunately had deteriorated and ended up on a ventilator on ICU, being looked after by my team. And I remember I had probably 5 shifts back at work, and all I could think about was I knew he was going to die. I knew he was struggling to fight it. But by the end, I just wanted to get through my 5 days with my team. When I was on my nearly second to last shift, they decided that he needed to come off the ventilator. He wasn't fighting it. And I needed that time to gather my thoughts, and ended up, we've got beautiful surroundings, ended up walking around, but this wasn't here, and it would have been really good to be able to come, sit with my colleagues, talk about what was going to happen. Whilst I was on shift, this was, well, I was here, so...
Now, Angela, what you've said there echoes a lot of feelings within the healthcare, really, which is you put other people's needs ahead of yourselves, and you came back to work really soon after your dad passed away. Why was that important to you?
I think it was about that you felt we'd got coronavirus and all my team were struggling. I just wanted to get back, and I knew my dad would have been proud.
Well, thank you so much. We've also got Dr. Allen, who is a consultant and has been for 10 years and is the Deputy Medical Director here. And he came back to frontline work during the pandemic. Alan, why was that important?
Well, the response from the teams at Airedale and across the NHS was just fantastic. Here at Airedale, from our cleaners and porters through our laboratory staff, doctors, nurses, therapists, the question from everybody was, what can I do to help? And I was no different in that, really. I don't think I could have sat in an office and in meetings doing the planning when I had respiratory consultant skills that could be used for patient care with my colleagues at the front line.
And we're here in this garden. Why is this garden going to be important to the well-being of the staff here at Airedale?
Yeah, this is amazing. It's early on in the pandemic, we set up wellbeing rooms in all of our clinical areas so that staff could have that time to get away from the clinical work and have a bit of a rest and relax. This is really important because, you know, particularly for our staff that are working in PPE on shift, they get the chance to come outside and you know, get some fresh air, and yeah, it's just amazing. Away from those cues also of the rotors on the walls and those things that remind you that you're at work.
Yeah, that's so important, isn't it, Lorraine?
No, absolutely. I think it's great to have a sanctuary. I mean, you've got to take care of yourself, especially should there be a second wave. I mean, this is, you know, we know that this is a marathon and not a sprint, that's for sure. And I know you're going to be planting a tree there as well today, and it's just a lovely place, very tranquil.
Yes.
Thank you.
Thank you so much. Yes, I'm planting a tree over here. I'm very honoured to do this, and I love gardening. So here we go.
Oh, good stuff. I think
Lorraine,
it's just. I'll let you get on with that. I'll let you plant your wee tree, and well done, well done. And I just think it's such a great idea. It really is. Look, he's multi-talented. He's a doctor. He's a TV presenter. He's a sound man, and he's also a gardener. It's fantastic. Thank you, my darling. I'll talk to you real soon.